Come in.
Hi, good afternoon. My name is Fran. I'm a nurse here at Brown University. Are you Miss Marie Adelson?
I am.
Okay, Miss Adelson, nice to meet you.
Nice to meet you.
What's your date of birth?
4:30, 7:05.
Okay. Do you prefer that I call you Marie or Miss Adelson?
Marie's
Marie is fine. All right. What brings you to the clinic today?
a general checkup.
All right. So right now today we're going to be doing the neurologic checkup. Prior to me doing the hands-on portion of it, I'm going to do the health history. Okay. I'm just going to ask you a couple of questions. Do you have any unusually frequent headaches or severe headaches?
No.
Any head injuries?
No.
Do you feel dizzy or any convulsions? Do you have any tremors in your hands or face?
No.
Any weakness in any of the body parts?
No.
Any problems with coordination?
No.
Any numbness or tingling?
No.
Any problems swallowing?
No.
Any problems speaking?
No.
Do you have a past medical history of spinal cord injury or meningitis?
No.
Alcoholism? Have you experienced any environmental or occupational hazards?
No.
Okay, very good. All right, so now what I'm going to be doing is the hands-on portion of the assessment, and I'll be checking your 12 cranial nerves, okay?
Okay.
So I'm going to be asking you to do a couple of things for me. If you see the things on the side, those are what I'm going to be using to check the cranial nerves. If you get tired or discomfort at any time, you let me know, we stop.
Okay.
Very good. Thank you. So, I'm just going to put this here. I'm going to wash my hands. Okay. So now, the first cranial nerve I'm going to be checking is number 1, which is the olfactory cranial nerve. I'm going to ask you to take a smell of this for me.
That's peppermint.
Very good. And this?
Vanilla.
Very good. Okay, so cranial nerve number 1 is intact. Okay, so now I'm going to check the cranial nerve number 2, which is the optic nerve. I'm going to be checking your vision. If you can cover one eye for me. Good. I'll cover the same eye. You tell me how many fingers you see in your peripheral, okay?
1.
Very good.
2.
Uh-huh.
1.
Okay.
2.
Okay. Now I'm going to check to make sure that your pupils are round, equal, and accommodating to light, okay? So just look straight ahead at me, okay? This is my pen light. Very good. Very good. Okay. Pupils are equal, round, reactive, and accommodating to light. Okay. So now I'm going to check cranial nerves 3, 4, and 5. That's your oculomotor, trochlear, and the abducens nerve. Okay. So now, tell me when you see the target inside. Okay. Cover one of your eyes for me. Very good. Now, tell me when you see my fingers come.
Yes.
Good.
No.
Yes.
Yes.
Good. Good. Very good. Now the other eye. Same test.
Yes.
Good.
I see it.
Mhm.
I see it.
Mhm.
I see it.
Very good. Okay. So those cranial nerves are intact. Now I'm going to check the trigeminal nerve. Now I want you to clench your teeth. I'm checking the masseter muscle. It's bilateral. I'm sorry. They're strong bilaterally. Now I'm checking the temporal mandibular joint. It's intact. Very good. Open your mouth for me. Good. No crepit is noted. All right. So that nerve is intact. So now I'm going to check the facial nerve. If you could smile for me. Puff out your cheeks. Very good. Okay. Facial nerve is intact. Now I'm going to check the acoustics, which I'm going to whisper to you.
Seven, 17, 27.
Very good. Okay, so that cranial nerve is intact. Now I'm going to check cranial nerve number 9 and 10. If you can stick out your tongue for me and say ah. Good. Okay, uvula is in line. The tongue is pink. There are no tremors noted. No abnormalities noted. Okay. Now I'm going to check your spinal nerve, which is number 11. Shrug your shoulders for me. Good. That's equal movement bilaterally. Now against my... Very good. Very good. Equal movement bilaterally. Was there any pain?
No.
All right. Do me a favor. Stick your tongue out. Move it up and down. Side to side. Good. Now repeat after me. Say light and tight.
Light and tight.
Very good. Okay. So cranial nerve number 12 is intact. That wasn't too bad, was it?
Not at all.
All right. So now I'm going to check your your cerebellar function. If you can stand up for me, please. Okay. Now just walk towards the door and back. Good. Very good. Okay. So her gait is steady. Walking is smooth and rhythmic. Arms swing freely to the side. Do me a favor for me. Now I need you to the finger test. I need you to touch your thumb to each finger fastly. Very good. Other hand. Okay, the finger test is intact. Now I want you to do heel to shin test. If you can have a seat for me, please. Now take your heel and rub it against the opposite shin. Good. Now the other. Very good. Moves in a straight line, up and down with no abnormalities. You feel any pain?
No.
All right. So now I'm going to check to see if you can feel the difference between sharp and dull pain, okay?
Okay.
Okay. This is going to be sharp. This is dull. All right. Close your eyes for me.
Sharp on my left arm.
Good.
Sharp right arm.
Okay.
Dull left cheek. Dull forehead.
Very good. Okay. So that cranial nerve is intact. Very good. Okay. So now I'm going to ask you if you do me a favor, just close your eyes. I'm going to see if you can identify objects that are placed in your hand without actually being able to see them. Okay.
A
How's that?
paper clip.
Very good. Thank you.
A coin.
Very good. And
A key.
very good. Okay. Very good. Very, very good. So now the last part of the exam, I'm going to be checking your reflexes. Okay. In doing that, I'm going to use this object to elicit movement from you just by light taps. Okay. If you feel any pain or discomfort, you let me know. We stop.
Okay.
All right. So first, I'm going to check you tell me. Mm-hmm. So all of your reflexes are +2, which is normal, is what we're looking for. If I saw that there were any deviations or abnormalities, then I would tell you definitely we need to follow up. But everything seems to be intact. Do you have any questions for me?
No, I don't.
Okay, very good. That concludes our assessment of the neurological system. Thank you so much.
Thank you.